Now, staying with coronavirus-related news, South Africa is witnessing a surge of COVID-19 cases and hospitalization. The country has reintroduced restrictions on public gatherings and liquor sales. Hospital admissions due to COVID-19 have risen by 59% over the past 2 weeks. President Cyril Ramaphosa has said that his priority is to make sure that there are enough hospital beds, ventilators and oxygen. In order to discuss the COVID-19 situation in South Africa, we are now being joined by Professor Abdul Karim. He is an epidemiologist and an infectious diseases specialist. So first up, how many variants are there in South Africa, and do you reckon the beta variant still is the dominant variant of concern?
South Africa at present has somewhere between 30 and 40 different variants that are being transmitted. Most of them are variants of no concern. The dominant variant is called the beta variant. It used to be called before the 501YV2 variant. This variant was the dominant variant in our second wave in January this year, and it remains now the dominant variant in our third wave, which just started about 2 to 3 weeks ago. We have had cases and we have had individuals who mainly have traveled, who have had the alpha variant, the gamma variant, and the delta variant. So we've had the others, but only in small numbers.
Meanwhile, sir, there are also almost 13,000 new cases daily and almost 8,000 cases in the Gauteng province. Are the numbers expected to increase as the days go by?
The third wave in South Africa is now on the increase. The numbers are on the upward trajectory. It is predominantly rising rapidly in one of our most populous provinces in Gauteng, where Johannesburg and Pretoria are based. The epidemic hasn't really grown to any significant extent in our provinces that are coastal, the Western Cape, KwaZulu-Natal, and the Eastern Cape. We anticipate that the numbers will start rising there in about 2 to 3 weeks. So we can expect that we will reach a peak in this wave in about the next 2 weeks or so, and then the numbers will start going down thereafter, though it might be delayed because of some of the coastal provinces lagging in their upward trajectories.
Okay, I'm just digressing a bit from hard data. What are your views on vaccinating children? Is it safe and ethical right now? Also, is it feasible considering the ongoing shortage of vaccines?
South Africa has focused its vaccine strategy on phases 1 and 2. In phase 1, we were vaccinating healthcare workers. In phase 2, we are vaccinating the elderly, and we're trying to cover as many people with comorbidities as possible. In addition, we are covering individuals in congregate settings like teachers and security forces. We are at this stage not focusing, we are not focusing our efforts on vaccinating children. Our situation right now is we have a shortage of doses, and because children are at low risk, they do not feature in our current plans. They are only scheduled for vaccination next year. In terms of the safety of vaccines, the safety of at least the mRNA vaccines has been established in children above the age of 12. And so it's now known that it is safe to give children above the age of 12 the mRNA vaccines. That's by Pfizer and by Moderna. The data on the other vaccines is not available yet.
Professor, before we let you go, finally, could you explain what accelerates the waves, and is this a pattern that will continue? And is this reflective of the nature of the virus?
we don't fully understand this virus. Every time we think we do, it does something quite different. What we have been seeing in South Africa is cyclical waves. The waves last for about 2 to 3 months, and then we go through a period for around 3 months or so where we have low transmission and not many cases. We think that these waves are being influenced by 3 things. The first is that we think that when we go through a wave, we have a whole lot of people infected and they develop some level of immunity, but that immunity wanes over time. And so in about 3 months later, the immunity that they have is no longer protective. And it might be, from some of the early data we have seen, that individuals who are infected asymptomatically, in other words, they don't have any symptoms, their immune responses tend to be lower. Whereas those who fall sick and go to hospital, they have immunity that is much stronger. So it might be that immunity is waning with time, and that's why we see these waves. But one of the things we have seen is what we call complacency. That when we are in the midst of a wave, people follow the rules very well. They wear their masks, they maintain their social distance, they're scared that they're going to get infected, their family members are getting infected. But what happens is that over time, they get a bit tired of that. They start going back and doing things that place them at risk. And then the third is that every time we are in low transmission, the government eases restrictions. And so with eased restrictions, there's a lot more mobility of people. So people are moving a lot more, and that may be one of the reasons why the virus then slowly begins to take hold and we get a new wave. So those are the 3 factors. We're not sure exactly how they contribute individually, but as a group, they probably are explaining, among many of the other possible explanations, why we see these waves.
Right, sir. Thanks so much for speaking to WION and giving us those insights. That was Professor Abdul Karim talking to us live from South Africa.